Well, it is 1 o'clock and it's time to get started. So thank you again for joining us for the COVID-19 WARN webinar. This is week 5. During today's webinar, if you're connected via Zoom, we're going to have interactions with the panelists in 2 of the following ways. You can either chat your comments or you can use the question and answer box. We do ask, though, that you do not raise your hand, as we do not have the ability to allow anyone else the phone line in order to be able to speak. So the best, the best method for asking questions is chat and Q&A. To use the chat box, we do ask that you change your setting at the bottom from panelist to all a panelist and attendees by simply clicking on the 2 and then selecting the drop down of all panelist attendees. You will be giving the ability for everyone that is viewing and listening into the webinar the ability to interact with your comments and see your comments. The question and answer box is also available for any questions you have that may have a little bit of length and that you would like for us to directly ask to either the WARN chairs or to our guest speakers. Please feel free to type your question in the box and then simply click send in the bottom right corner. If you are connecting with us via YouTube Live, there's also a chat box located on the right-hand side of the screen. That chat is being monitored throughout the webinar, and the questions can be asked to the panelists at that time. Today's webinar is being recorded, and it will be placed on our WARN website for future viewing. Live webinars are currently all that is being offered for operator credit, but we do appreciate you listening in to the recorded version if you're not able to be here in person. And please check out our warn.org website for any future information in regards to these meetings. There's also a wealth of information on the website that we will get into in just a little while. With that, I'm going to start recording our webinar, and we'll turn it over to our WARN chairs to get started.
All right, well, thank you everyone for joining us today. This is our 5th time talking about COVID to the water and wastewater utilities, trying to keep you guys updated as best we can. Like we said way back on the first one, all we're trying to do is give you information as we know it. We're not trying to be too speculative on what's going to happen. But again, thank you for joining us. Like Geneva said, we were able to work with DPOR due to a lot to her efforts to get you guys some credit to be on today. All right, so we want to thank our state agency partners that may be listening. They're a constant flow of information for us. That's how we get a lot of our information that we're sharing with you. So Virginia Department of Health Office of Drinking Water, Virginia Department of Environmental Quality, all of our WARN members that are on, and our Virginia utilities that will hopefully become our future WARN members, those that aren't already actively part of the WARN. Any additional Virginia partners that we have for utilities, whether you're a consultant or maybe you're part of the supply chain management program, or maybe you handle some type of maintenance or anything else. And if you're listening in to kind of hear how things are going, we appreciate you being on the call too. So the way we typically do these every week is we kind of give you a current status on where we see things at the moment. Obviously, we've been going at this for a while here in the U.S. This is, like I said, this is our 5th week of presenting straight to utilities and the wastewater community. So the information we have is what we've taken away from that timeline. So far, we don't have any real new updates from BDH or DEQ that you haven't already heard. So we're going to move on to the next slide. This is the health map as of this morning, pulled straight from the Virginia Department of Health website. You can see that our number of cases are still growing. Total cases in the Commonwealth are almost at 15,000, with roughly 2,300 folks in the hospital. As of this morning, we have 522 confirmed deaths back to COVID. So this is still an ongoing scenario, and we still anticipate seeing these numbers increase. Hopefully the rate of increase is going to start dropping off, but these numbers will keep going up for a little bit yet. Next slide. Scott, did you want to speak to this slide?
Sure, Ike. As we've shared in the past, this is the IHME model that we've referenced. Still seems to be the preferred model nationally for understanding the likely duration of the event. We had a question last week asking about application of federal guidelines and pointed out the federal guidelines for reopening call for a 14-day declining period. And the model indicates we should be seeing that. Of course, yesterday was a reset on some of the high numbers we saw. So again, we don't have any specific information. We'll be looking towards the governor's future release, but the model is indicating to us that it probably is appropriate for entities to begin a planning process of how you may modify your operations moving forward.
Gotcha. I know that some of you may have heard that the health commissioner is saying that the phase one piece of this, as we start to reopen, can take up to 2 years. So we will try to stay as informed as we can to give as much information as we can, but they're thinking that some of these schools may not open for quite a while yet, which that means, we're going to have dead zones. We're going to have areas that are going to need flushing during that process, if that is true. But everything is subject to change. But that is the information as it was pushed out yesterday by the health commissioner. Okay, next slide. So today we have two folks from Aqua Law, Chris Pomeroy and Amanda Waters, as well as Eddie Shelton from the Virginia Risk Sharing Association, formerly VML. And at this point, we're going to ask Chris to kind of lead in and give us some updates from Aqua Law, and then we'll move on to the risk sharing after Aqua Law has a chance to speak.
All right. All righty. Very good. Thank you. Good afternoon, everyone. I'm going to begin with just a couple pointers or recap on regulatory compliance. We were fortunate to have with us previously Dwayne Roadcap from ODW and Jeff Steers from DEQ. Each of the agencies has issued a guidance document related to regulatory compliance challenges that you might encounter if we have, in the unfortunate case of any worker shortage issues or laboratory capacity issues, for example. The thrust of that, just to briefly recap, is really focused on early, timely, good communications. So please do be reaching out to the agencies if you see a situation developing that relates to your regulatory compliance. It will also be important to contemporaneously document the situation, how it's driven by the COVID situation and your response, so that after the fact we can get that fairly sorted out for you. The agencies have been good about indicating they'll exercise reasonable enforcement discretion. I take that to mean that if adjustments are required by you due to things outside of your control, like the response to this COVID situation, that they will not penalize you. But it's our job to make sure that that's well documented so they have an ability to help you with the right conclusion on that after the fact. So a usual plug for just a good, timely communication and documentation to help with good outcomes on the back end, so you're not unfairly second guessed. In the near term, perhaps issues might relate more toward things like sampling or reporting. In the longer term, I suspect some of you will have discussions about capital improvement program adjustments and adjustments to any mandatory schedules you're currently under right now for projects in light of some of the economic issues that we know you're managing, and Amanda's going to discuss possible responses to in just a moment. So With that, I'll just refer back to the the DEQ March 31 guidance, the ODW April 1st guidance, and encourage good communications and documentation. I would offer, if I know no one's looking for a free pass, you're working hard, and we're fortunate to have each of you on the front lines managing this situation. If you feel like you're being treated unfairly, having made the types of efforts that Steers and RoadCap and now myself have mentioned, please don't hesitate to let me know. I would not want to see anything like that promulgate across the state, and happy to help nip it in the bud if there's anything that we can do in that regard. With that, let me quickly introduce Amanda Waters, new to the Aqua Law team. She's not new to many of you who have wastewater utility responsibilities and have been involved in the National Association of Clean Water Agencies, where she came to us previously being their general counsel. Amanda's no stranger to the water industry, but she is new to us, and she's here today in her capacity as here at Aqua Law as our COVID-19 response team leader, so that we've consolidated in her our support of the utilities in the 6 states where we routinely work. So with that, I'm going to ask Amanda to touch on some of the developing issues in the fluid area of potential economic relief.
Thanks, Chris. Good afternoon, everyone. So as Chris mentioned, I'm going to give just a very quick snapshot of federal coronavirus funding and some workings at the state level. So I think we all know that in March, the Congress and President Trump signed the CARES Act, which has the Coronavirus Relief Fund. In that, there is $3.1 billion for Virginia that should be distributed very soon if it hasn't already. Now, distribution of that state share is totally within the state's discretion. So local governments really can't fight the way that the state is distributed, but instead must justify the need and convince the state of the importance of sending a fair share to the local level. The Virginia Municipal League and Virginia Association of Counties have been attempting to do just that. They met with the governor's cabinet to explore how to secure funds for local governments. And VML shared their impression from that meeting, and it's that if the state decides to share the funds with local governments, it will be half or less of the $3.1 billion, and it will likely be distributed per capita. So the message we got from them is that it's an uphill battle. VML stressed the importance of having a consistent message and the data on local financial impacts to back up that message. So it is important that you continue to track and document COVID-related costs and revenue losses. I know you're doing that already. Make sure that you're providing that information to your local government leaders and or to VML directly. And that's important not just for this chunk of funds, but also for other sources of funding that may become available. And switching gears to look ahead, will there be another federal stimulus package? Yes, as I see it, yes. That's my magic 8-ball answer. It's very likely that there's going to be another package passed by Congress in May, but what form that will take is still very unclear. House Democrats want more funds for state and local governments and for infrastructure. Speaker Pelosi has proposed a $770 billion package over 5 years for infrastructure. But the Senate Majority Leader, Mitch McConnell, said on Tuesday that infrastructure will not be part of Congress's next coronavirus relief package. And what he said was, we have an equal interest in doing an infrastructure bill. We don't have an equal interest in borrowing money from future generations to pay for it. In other words, it's unrelated to the coronavirus pandemic. So there'll be a lot of negotiation in Washington next month on what funds will be available and what they can be used for. So in the event that an infrastructure package is passed, we want to be as shovel-ready as possible. I'm sure most of you remember the American Recovery and Reinvestment Act that was passed more than a decade ago in 2009. How time flies between economic recessions. I think if you were involved in acquiring those funds, you know that there were some hiccups on rolling out funds because you can't just flip a switch and have a project shovel ready without advanced planning. So our advice is to be better prepared. What you may want to do is look at what projects that you know you need to do, that you can get shovel ready with minimal or reasonable level of effort, so that if those funds become available, they can be put to good use and help get residents back to work. There's a lot of national advocacy going on, trying to push for funds to be made available directly for public water utilities. You've got the National League of Cities, National Association of Counties, U.S. Conference of Mayors, all advocating for funding for local governments. And then for public water utilities, you've got the American Water Works Association, Water Environment Federation, and the National Association of Clean Water Agencies. So you may have already received requests from those agencies if you're a member for information on your costs and revenue losses and infrastructure needs. So we encourage you to provide that information to those national associations as they continue to advocate on the Hill. So that's the very brief update. Chris and I'd be happy to answer questions if there are any.
Amanda, kind of tying into what you just said, one of our attendees posted this question, if you guys would like to weigh in on it. Is there any information regarding in future stimulus packages funding for public water and sewer utilities that are hit hard by revenue losses due to mandated business closure and suspension of late fees and service cutoffs due to unpaid bills?
There certainly is a lot of discussion going on amongst those groups that I just mentioned. AWWA and AMA put out a report that talks about that as a major source of revenue loss, particularly the suspension of shutoffs. So that is being communicated to Congress. And I know that House Democrats are aware of it, and they're looking for ways to send funds directly to water utilities. But that hasn't made it into anything that I have seen yet. And I think it remains to be seen whether it'll make it through a package that both the Senate and the House can agree upon. Chris, do you have anything to add to that?
I'll just add that in terms of what we can be doing about that, first of all, I'll compliment VML and VACO for having included information like that in the material it's tracking, for example, the cost of no shutoff policies. The information, by the way, is that report that Amanda referred to was done by one of the rate consultants that a number of you often use, Raftellus, and they did a nice job hitting all of the items listed here in Bob's question. So that information is definitely circulating in Washington. Today, VML and VACO, yesterday they told us that today they were issuing a survey to their member localities, the counties, cities, and towns, that's asking about costs hitting at the local level. So for the public utilities, public works departments on the phone today, make sure that you're plugged in within your local government in terms of that response to assist with the utility component so that those numbers are on the table. It's a little more challenging, I think, with authorities. When we have authorities, a water or wastewater authority serving a single jurisdiction, oftentimes, but not always, your boards are one and the same as the county board, let's say. So I would suggest feeding that same information in that example through the county government. For our authorities with a regional footprint, a regional service area, a little bit more challenge, I guess, in the sense that you have that larger footprint. What I would encourage there is taking that same type of information on the costs of this current predicament and pushing that out through your member jurisdictions. Oftentimes you'll have a councilman or supervisor on your board from each of the localities or somebody at least appointed by them, and have those connections, of course, in the communities you serve. I would feed the information back to maximize its consideration. Of course, I think everyone's sensitive to the fact that everybody's budget is getting hit. every social need is getting hit. And even though the things that are most important to us, and it's very important publicly, water and wastewater, there's a lot of needs out there in the governmental sphere. But by advancing this information, I think we'll be in the best position to be fairly considered in the decision-making process as it plays out.
That's good information. We have one more question for you two from our attendees. This one's coming from Jim out in Virginia Beach. Is there any traction for states to declare bankruptcy? It's a two-part question. That's part number one. Second part, is VRS a lockbox that can be rated?
Yeah. Hi, Jim. Chris. I don't think there's any credible traction, despite a lot of the chatter in the news on the bankruptcy aspect at the moment. And candidly, I'm just not familiar with the provisions under which VRS operates. So I can't apologize. I can't be better help for you on the latter. Let's hope it's a lockbox.
And we'll try to see what we can do to get these. If we can't answer them today, we'll try and research some of these answers. But I'd want to thank both Chris and Amanda for their comments thus far. I'm sure we'll have more questions as we go along. We're going to move on to, or Chris and Amanda, before I cut you off, do you have anything else you want to say to the group?
Thank you for having us with you today, and good luck doing the great job we know you always do.
Yeah.
So our next speaker is going to be Eddie Shelton with the Virginia Risk Sharing Association, formerly VML. Eddie, I'll turn the mic over to you.
All right, awesome. Thank you. So I'm a consultant for the Virginia Risk Sharing Association. I first want to thank everyone for inviting me out to talk a little bit about some of the issues that I've seen from that perspective in terms of the intersection of the virus and then safety recommendations and ideas that can be put in place to better protect you and your employees and your families. And like you guys, we at Versa, we've kind of changed it too. We have a skeleton crew at the office. Others are working from home, and it makes it even more difficult during this time because we really don't know when or even what the finish line is. So when things get back to normal, but in water and wastewater, the show kind of has to go on. So I do have a couple of key points that I want to hit on, and I think they are in. Let's see here. Can you guys hear me a little better now?
Yeah, it sounds a little better on my end. But I'll ask
sorry about that.
For the attendees, can you hear them better now? It sounded like it cleared up just a little bit.
Yeah, I think it's better.
Okay, perfect. Sorry about that. Yep. Thank you. So yeah, basically I just have a few key points that I want to hit on. That our members are working through some of this stuff without interrupting services to their citizens and customers. And so the first key point is kind of understanding your people. And obviously your work is essential. And the work that your employees are doing is essential. So during this time, we've seen a lot of issues in the news talking about how going through times like this can really impact a person's mental state and their mental health. So you may have employees who are a little bit more emotional, prone to stress and other negative issues. So I do want to make sure that you're talking to your employees and urging them, get out in the sun, take walks, spend time with family, and do things in their off time where they can better unwind. And even something like this, a couple of days ago, unexpectedly, I got a package in the mail from Versa with a couple of face masks in it and a card. And again, it wasn't much, but it meant a lot to me to know that Versa cares for me and my family enough to send a few face masks and a card. I say that to say this: make sure your essential employees actually feel like they are essential and taken care of, and actions do say a lot more than words. So one way to help on this from a personal level is just to discuss ways that you can better look out for your employees during this time, whether it be a card, a socially distanced pat on the back, anything you can do to kind of help out, because people are feeling a lot more stress. Kids are at home, so parents are having to decide who works, who stays at home with the kids. And it's just a lot more stress that your employees are going through. The second area I want to address is safety, and then also your public image during this time. And it's kind of a time where the federal and state governments are agreeing on the importance of face masks. I do want to urge you to look at your personnel from the viewpoint of the public. And I say that to say this: if I'm driving by a work site that your employees are working on, and I see 3 people working without face masks on, my immediate idea may be that you and your employees are not taking this seriously. So I do want to recommend the use of face masks, for the safety of your employees and their families to prevent them from, taking anything home with them. But it also helps preserve the reputation of the organization. And being in water and wastewater, you all know better than I do, one black eye can last an awful long time. And so I know many organizations have already adopted policies in which if multiple people are in a company vehicle together, they're required to wear face masks, which I believe is the right call at this time. But I also want to make sure you're kind of aware about upkeeping your public image through all this as well. The third area I kind of want to address, it helps reduce the spread of the disease, are your administrative controls for work. There are numerous very simple ways of putting policies in place to help further reduce the spread of the virus. And I've recently spoken with a number of our members who kind of shared their new report to work policy that they've implemented. And one of our members, what they're doing is they're working in teams in public works. They're divided into 4-person crews. Each crew reports to work staggered in 10-minute intervals. They also have their shift meetings outdoors, weather permitting. And it also allows crews to be able to have their meetings and be socially distanced while discussing daily issues and having regular toolbox talks and stuff like that. And so what it looks like is at 7 a.m., the first crew rolls in, they clock in, and they head outside to wherever the meeting area is going to be or whatever. At 7:10, the next crew shows up, and basically at 7:30, the last crew shows up. They have their shift brief. Everyone gets to work on their respective jobs for the day. I didn't really discuss with them the clocking out, but my assumption is that clocking out works the same way, staggered in 10-minute intervals. And that kind of helps us control the costs associated with paying overtime and making sure each employee is still working an 8-hour day. So looking at the ways you can change around your shifts or the number of people who are working together, it definitely can help reduce the spread of this virus. And so I know that many people and many organizations, they were unable to secure PPE because of supply chain breakdowns. But I do want to add one little OSHA tidbit here on the respiratory protection side. If you have given your employees surgical masks, there's a letter of interpretation from OSHA that says that this type of mask, the surgical mask, is not a respirator and does not fall under the OSHA purview for respiratory protection. However, if you have given your employees form-fitting dust masks, N95 respirators, or anything greater, you are required to comply with the OSHA standard. And that means if they are voluntary, you're required to complete an Appendix D. And depending on the type of respirator, you may be required to do a medical evaluation as well. If you require the use of one of those, you need to meet the requirements of the OSHA standard if you require respiratory protection. And it can be a little confusing. So if you are a member of VRSA and have questions about this, please reach out to me or any of whoever your safety consultant is, and we'll be happy to kind of talk you through that process and provide you forms to kind of help simplify the process. And again, I know that respirators, they may be a little bit difficult to come by. So if your organization is finding it difficult to get those face masks, there are other ways that you can implement protections at little or no cost to you. And kind of what that does is, where possible, there should be policies that only maybe allow one person per office or in specific rooms, which help with social distancing. I know a lot of you may have labs, and you may have 2 or 3 people working in those labs. It may be helpful to maybe tape off an area and say one person each in each area, and that helps with the distancing. In another area, we all love meetings, right? We all have a ton of them, and we wish we could get less of them. A great way to have a meeting and keep it short, and in some cases help with mental health, involves having meetings outdoors where feasible. I know a lot of private industry organizations, particularly construction and private utilities, they've begun to go this route. And another option is internal web-based meetings, and that's what we at VRSA are doing. We actually had an in-house meeting this morning using Microsoft Teams. And again, it's another means of social distancing. And so last week, a study was done showing that sunlight and humidity could weaken the coronavirus on hard surfaces and in the air. And it seems like every week there's new information or a new study coming out, but hopefully as temperatures rise, along with humidity, we see this kind of mess start to taper off. I didn't want to take a lot of your time. I hope it's given you at least a few ideas that you could implement to protect your employees. And again, thank you for your time. And I see there's a few questions, so I'll kind of go through those as well. So is there, let's see, You may have to get a little bit of assistance with this question. Is there any information on PPE orders to VAA WWA per an email about a week ago? Scott, are you?
Roger, Geneva engaged that one. Yeah, Geneva already posted back. We are doing that. I didn't mean to cut you off, Scott.
No problem.
So she posted back, and we'll talk a little bit more about that as we get into the presentation today.
Awesome. The next question was about reusable cloth face mask been requested. Okay, that's what she just posted. Perfect. I will absolutely share my contact information. If you don't have it, my name is Eddie Shelton, and I can be reached at email at eshelton@versa.us. That's eshelton@vrsa.us. eshelton@vrsa.us. My cell phone number is 804-387-3078. That's 804-387-3078. And are you saying, next question was, are you saying that wearing dust masks for COVID purposes require Appendix D only if respiratory protection is already required for the job? So what the Appendix D is, it's only if a respirator is going to be used for voluntary purposes. For instance, if you have an employee who mows the grass and he wears a dust mask just to prevent allergies, that's voluntary. That's where the Appendix D comes into play. If you are requiring that an employee wear a dust mask, an N95, a respirator, whatever it is, you're required to follow the OSHA requirements in the respiratory protection program. And that's going to be in 1910.134. That's the standard where it can be, which is going to require you to have a written program. You're going to train your employees. And depending on what type of mask it is, you're going to do either a medical evaluation and or a fit test. Well, not and or. It's either going to be, you're going to do a medical evaluation and you may have to do a fit test. I hope that answers your question as far as if an Appendix D is required. If you don't have an Appendix D and you are with Versa, let me know and I can get you one of those emailed over to you. It's pretty simple. It just sounds a lot more complex than what it actually is.
Eddie, if I could, a lot of us in the utilities right now, because of the social distancing policies, we have employees perhaps greater than any point in the past working as lone workers, very small work teams. Have you seen anything specifically that you'd recommend on lone worker safety, best practices in that particular area?
So that's a really good question. So even if you have one employee, you're just as responsible for them as you are if they're working, in a group of people. So one of those things is going to be the trust that you put in the person. Are they going to be following your policies? Are they, wearing proper PPE when they're supposed to be? Are they using lockout, tagout when they're supposed to be? So part of that is going to be the follow-up that you have with the employees. If you have an employee who, for instance, is doing work on on a piece of machinery, it maybe you need to find out, are they actually following their lockout, tagout policies, and how you go about doing that. I think it's going to vary place to place. It may be discussions with them. It may be that they're given a checklist on something and they had, turn it in at the end of the day. And, you're talking about working alone. A lot of times, they obviously have to take a vehicle with them when they go work. I've seen a lot of private companies. They've started a policy now where when a person finishes operating a company vehicle, they're required to wipe it down, the steering wheel, gear shifter, door panel, everything they've touched to help reduce the spread. So when the next person uses the vehicle, that can be lessened. I don't know a way to have one employee and to verify they do everything correctly every single time, just because the human factor comes in there. And you guys know as well as I do, you have some employees who, you trust, they know their job, they do it the right way. And you have some employees who they're going to naturally cut corners because they want to find the easiest, fastest way to do a job. Does that kind of answer
from a security?
Question?
Go ahead, Scott. I'm sorry.
Oh no, you're fine. Ike. Go ahead.
All right. From a security standpoint, some of the things that we've talked to utilities about, mostly around meter readers because they are out alone, is going to a body cam type scenario so that at least you have something to back up what's going on. In the world of safety, the camera is only good after the fact. It's not going to protect them during the fact. But that is something to verify. Are we doing all the right procedures? And it gives you something to review, and then maybe you go back and you see where those training highlights are that you need to hit.
Yeah,
And
and another thing too, I've seen a lot of people to do is they have the GPS stuff in the cars, so they can tell if a meter reader's been parked in the same spot for an hour and a half, there could be some kind of issue if the car hasn't moved. Again, the usage of that's going to vary. If you have a water authority that has 15 employees, it's going to be a lot different than an authority that has 150 employees.
Perfect. Stacy, I'm not 100% sure I'm reading your question right, but it says, can you address this topic per safety of the employee? You may want to kind of guide us on there, but Eddie, did you want to speak to that?
So regardless whether you're going to have a team of employees working together or whether you're going to have people working from home, you as the employer are still going to be responsible for ensuring that they have a safe and healthy workplace, and that's the very bottom line thing that what VOSH looks for. But what they've also put during this, especially with like the respiratory protection plan, is they started looking for good faith efforts. Are you making every effort you can to follow the OSHA standards in this, particularly with the respiratory protection? They realize your business may be closed, elective surgeries are stopped, so doctors may not be able to do a medical evaluation now. So are you doing everything you can to protect the employees? That's something they're looking at. Also, I spoke with as many of y'all know, before I started working for VERSA, I worked for Virginia OSHA. I spoke with the Roanoke office for VOSH enforcement yesterday, and they've informed me that just because of this too, they have changed the way that they're doing inspections, and that right now they're only doing inspections which result in fatalities, hospitalizations, amputations, loss of an eyes, and complaints. They're not going out and doing general inspections right now because they're trying to socially distance as well. So we talk about the safety of the employee. It's still going to behoove you as the employer to ensure that your employees are still working as safely as possible and that you're doing your due diligence to protect your employees.
All right, perfect. Thank you. Let's see. Reading Jim. Jim just posted a question real quick from Virginia Beach. Have you found any good talking points of how to keep employees safe and without fear, yet balanced with HIPAA laws? I don't want to work with anybody returning from quarantine. You put that in quotations. Basically, how do you not violate the HIPAA laws but keep people safe around folks coming back from quarantine?
Yeah, so with that, obviously you don't want to share, anybody's personal healthcare information. However, what you're doing there, by having, the recommended quarantine, you're following government and state guidelines in that. And I know that my wife works for a city in Virginia, and they had an issue like this where an employee had traveled, had come back, and they were worried about them, infecting others. So they set up for the quarantine, which was recommended for the 14 days, came back and had no issues. And if you look across the statistics that have been pushed out by the CDC, that 14-day quarantine seems to be a good indication where if a person is going to show symptoms or if a person is going to get sick, it's going to be within that 14-day window. I think you're still going to have a situation where you're going to have some employees who just, it's human nature to be scared of something that they don't really understand and that we don't really have a cure for. But if you follow the CDC guidelines, I think you're going to be protected because those are the most up-to-date guidelines we have based off of, statistical studies by doctors and professionals in their specific fields.
All right. Thank you, sir. All right. We'll keep checking the chat and the questions as we move forward. Do any of the three panelists have anything they want to put out before we move on to the next slide? Chris, Amanda, Eddie?
I just want to definitely say thank you all for having me, and I'll be more than happy to help anybody who needs it.
Thank you, sir. And we'll make sure and get your contact information out as best we can. And Chris and Amanda, if anybody has questions for Chris and Amanda, if they want to post them back into the WARN, we'll try and make sure your questions get answered also. I'm going to ask Geneva to put up our first poll question right now as we talk about our warrant updates. And the first question for those of you that aren't on the live version, has the information on the warm resource page been helpful to your utility? And you have 4 choices here. First one is yes, then no, somewhat, and then haven't visited the page. And by participating in the questions, it helps us get you your CPUs. All right, so our warrant update slide. As of today, we've had no formal requests come in through warrant for us to fill. Primarily, we've just been information sharing that seems to have handled 90% of what people are looking for thus far. We've made some website updates, and once this question's answered, I'll let Geneva talk about the website updates. Let's see. So has the website been helpful? 63 people answered with a 57% saying yes. 1% said no. 12% have said somewhat. 31% haven't visited the site yet. So I'm going to let Geneva talk a little bit about what we're doing with the website. She's made some changes and added a few things. Geneva, if you got it.
Sure. In fact, what I'll go ahead and do for those, since we do have a 31% that haven't visited the page, I've just pulled the page into the webinar. Hopefully you should be able to see it now. If you're not, let me know. But we have a variety of information, somewhat categorized or put into groups. So the top is a lot of agency information and updates. The supplier list that we spoke about heavily last week and was emailed out is updated here. So anytime we get new contact or new suppliers added to the list, that will be posted. Some economic impact section. Thank you to Chris and Amanda for talking specifically about that section. We've got some items there. A little bit farther down, specifically, Eddie has given us a lot of good information about safety and safety suggestions. So there's a section there. HR issues, operator credits, you name it, we try and put it on this webpage. Anything that is new, and that would be since the last webinar, is indicated with this nice red new button. So those of you that come back and check it about once a week, you'll be able to see really quickly what information is brand new since the last time you were here. And I do keep the date up to date here at the top. So that's the Warren resource page. It is available to both members and non-members just by clicking underneath News, COVID Resources.
Okay. So Geneva talked about the supplier list. So we have one more poll question for that. If you want to go ahead and post that one, Geneva.
Right. There we go.
All right. So this poll question is, has anyone been able to use the supplier list to help alleviate a supply chain issue? Those of you who have logged in before, you've heard us talk about how some utilities have had to break up their supply order across different entities to try to still meet their demand. Others have had to reduce what they're ordering. So that's where this question is posted around. So your 3 answer choices are yes, no, and I do not purchase supplies, because we have some folks that are listening that are not utility based. All right. So we have 14% that said yes, that the supply list has helped them alleviate some supply chain issues. 40% that said no, it hasn't given them any help at all. And 46% that said I do not purchase supplies. So for that 40%, if there's anything we can do to help meet that need, if you can share that with us, we'll try and see what we can do to help get you some information also. All right, and we have somebody posted in the chat. Let's see, from Cody. Do you have any recommendations for independent operators struggling to get chemical supply in small quantities? That's an excellent question, Cody. Mike or Scott, do you have anything you want to weigh in on with that one?
It would be helpful if we had a clarification. Are we talking about treatment chemicals? So if Cody could refine that a little bit or add a little more information, we might be able to help.
Mm-hmm. So Cody, if you're still listening, Scott is saying, are we talking around treatment chemicals, or are we talking about some other? Up there we go. Nope. I thought he posted there. Oh, there we go. Do you have any recommendations for independent operators struggling to get chemicals supplying small quantities? Bleach primarily is what he's requesting.
I think that if it's drinking water based, if you're operating a system that's covered by ODW, that would be my suggestion for a starting point to see if the health department could be a resource. DEQ would be an additional option. A lot of times the agencies are very helpful. They know other operators in the area, and so they may be able to help you expand your network, because a lot of these issues are going to be locally based. And so regional DEQ office, regional health department office would be my starting point to try to make connections and find some of those resources.
Gotcha. All right, Cody, I know that's not the perfect answer, but we may also have some folks on that may be able to help you with some of that. Let's see, ODW has limited resources, but DEQ is a good idea. Thank you. Okay. If you're not able to get that answered or get that information, Cody, if you can send at the end of this, our email addresses will be up there. If you can send it to us, we'll see if we can help you find someone that might be able to get you some of that. I don't want to promise we can deliver, but we will definitely exhaust what we can for you. All right, I'm going to move on to the next slide. So this slide, we're talking about best practices. We talked a little bit about our flushing program from last week. Mike brought up in our discussion earlier this week about fire hydrant inspections and painting. Mike, did you want to talk on that one a little bit?
Well, if utilities, they always seem to say that they don't have time to do the inspections and everything else because they're being pulled in 40 different directions. If you got people that are having to work solo, and as the weather warms up, this is a good opportunity for hydrant maintenance as far as inspections and painting goes. So that's something they could do to fill in the time gaps.
And that kind of plays on that small single person task work orders, those things where you're trying to find things that people can do on their own without having to team them up as much. And we heard from Eddie on the lone worker safety. Scott, did you have something else you wanted to talk on that, or did we cover it all through Eddie?
Yeah, I think there is the additional point that's a best practice for utilities to consider, and that's whether you adopt periodic check-in procedures when you do have lone worker conditions. Obviously, you're going to have potential situations, small plants. It depends on the utility, so you would want to structure those procedures. Oftentimes, like most utilities, we have small teams that work together, but because of social distancing, we may have individuals outperforming tasks. I think it is important to have some regular check-in procedures so that you would be aware if the employee encountered any kind of issues, problems on the job, suffered a medical incident, because if you're not ensuring that you have periodic check-ins, that person may be subject to not being found for some time. So those are all the issues. At the front part of this, I think everybody scrambled to implement adequate social distancing. But as we continue to have this drag on, I think it's really important to make sure that you've thought through lone worker safety procedures.
Gotcha. All right. And then one of the other things that we had talked about earlier this week is, are any of you having any changes around how you're doing your first aid, i.e. especially around the first aid training, the CPR piece? Now that we're having this social distancing, how do you give mouth to mouth to somebody? So we're just kind of curious if anybody's changing what they're telling their employees about administering first aid at this point. So our first that question is, have you changed or considered changing your first aid procedures due to COVID-19 pandemic? And your choices are yes, no, and I don't know. And Scott Stacia said, thank you, that's a good idea.
Still have a good number of responses that are coming in, but I'll give it another second or two and then I'll close the poll out just so we can share it. All right, here we go. All right, so 13% said yes, they are doing some changes or considering doing changes around how they're doing first aid procedures. 46% said no. 41% say that I do not know. And like I said, this was just a question that, or a conversation that we had as the Warren group on Monday, and was something that we had started talking about, especially like on fire and EMS. As we're getting our calls now, dispatchers are actually doing a COVID-19 checklist with the person on the other line before they actually dispatch, and we're getting a response back as to whether or not they answered favorably or unfavorably against these COVID-19 questions. So then we were just kind of seeing how this is impacting us as utilities, what practices are changing around this. Did anybody on the group want to weigh in on that? I don't want to cut you guys off. All right. Our next bullet comment on here is preparation for hurricane season. Yes, we are still in COVID, but as we've talked about all along, COVID will end about the same time hurricane season begins. Maybe as we're doing more work from home, we can be knocking out some of that NIMS training to be compliant. As you know, in order to get some of our response dollars back, one of the questions from FEMA is, are you NIMS compliant? This would be a good time to be addressing that and trying to get this done, because a lot of that's online. Mike, did you want to speak to this one? This is one of the comments you had on Monday.
The online availability is ICS 100, 200, 700, and 800. Your incident commander typically has to take 300 and 400, which is a registration for a class, and actually sitting in a seat for about 3 days for each one of them. But most of your employees can do the 100, 200, 700, and 800 online. Takes a couple hours for each one, and you take your test and your certificate printed right then and there if you pass.
All right, I'm going to move on to the next slide. This is about supply updates. We've kind of talked a little bit about plant supplies. We've got that supply vendor list on our website. Scott, did you want to speak to plant supplies? And I'll have Mike speak to field supplies real quick.
Sure. As you mentioned earlier, we have not had, today's kind of one of the first questions we've seen on a treatment supply limitation. Generally, the large plants that we've been in contact with, it seems like the supply chain has remained stable. So as of this point, I think we're all in pretty good shape.
Mike, are you guys seeing anything with field supplies?
The only thing we're seeing is that our suppliers, such as Ferguson's and Fortiline and HD Supply, their method of taking orders and delivery has changed up. So they're going to have to allow more time. If you need something, don't wait a couple extra days to see what happens. Go ahead and place your order, because there's some supply chain issues from bringing them in from the ports or wherever. And it's easier if you go ahead and do it, because it's going to take probably another 24 to 48 hours to get their supplies.
Awesome. All right. Kenny Reynolds is saying Grace Loan Worker Safety Supplies or Safety Systems may be a possibility for equipment. And he shared a website on there. We'll make sure we get that captured too. Thank you, Kenny. FEMA supply chain cloth masks. I'm going to leave this one to Geneva.
So we have been informed that our order has been placed to FEMA. We have not yet received the cloth masks inside the state of Virginia, but we anticipate, best guess is 2 more weeks. That was the update we received on Monday. I do know that other states have received theirs. They were going on somewhat of a triaged approach of the states most impacted. We're getting the first shipment, but we anticipate to have ours in approximately 2 weeks. If you have already put in your request, you should have seen an email from me and possibly 2. The information that we need to document and provide back to FEMA just to qualify and make sure that they're aware of how these masks are being distributed is in the email request. We need the number of employees, your primary permit number, be it water or wastewater, and the mailing address. We have taken on the task that we would like to mail out these masks as opposed to have different sites around the state where you would need to come and pick them up. We think for worker safety and then the facility safety and not having visitors come, that's the most prudent way to disseminate the masks. If you have not yet requested masks, but you are a water or a wastewater utility, please email me. The email address is in the screen. And I'm still taking requests. We're going to fill them as a first come, first serve, but right now we anticipate having enough masks to fill all the orders. So send me those 3 pieces of information and we'll do our best to get you masks as soon as they're arrived into Virginia.
Thank you very much. And this is not just for WARN members. This is, if you're a utility, if you can get that information, and we'll do our best to fill that need for those masks. Okay. Our next slide. Modifications to operations. This is a conversation that Scott was leading with us on Monday, especially around dairies and breweries. Scott, did you want to touch on that?
Yes, and actually this, most wastewater utilities have likely seen some communication on these issues. We've had requests come in from brewery operations. Recently we fielded one from dairy operations for disposal of waste. These are high strength waste products that typically would not come, particularly in the volumes that are being discussed. Just an encouragement for plants to have their pretreatment staff reach out to some of these operations. It's ideal when we know that there's a request and we can deal with that during a conversation of whether a facility can accommodate that request, can handle the waste, or whether the facility cannot and direct them elsewhere. Worst case scenario for your utility is that this gets dumped into manhole, it's brought in septic, any of those type of paths into the facility where the operators are not aware and can cause a disruption to your biological treatment process. So the further this event goes along, the more chance that we're likely going to see the unusual waste stream requests, and perhaps even from areas where they don't typically work with wastewater utilities. And so it's even more critical that you have boots on the ground to make sure that you're in contact with food industries, likely sources in your area, to try to head any problems off. And with that, we do have a poll question. Has your utility been requested to handle food waste products or unusual waste products due to COVID?
All right. We have 9% said yes. Oh, I'm sorry. Go ahead, Scott.
Oh, no, you go ahead, Ike.
Right, so 9% of you said yes, you have had an issue or request. 48% are saying no, and 43% say currently this does not apply to them. Okay. That's good information. I do apologize to the group. I think we're going to run just a couple of minutes over, but if you bear with us, I think it's well worth the extra couple of minutes to spend with us on the call. All right, next slide. And I did get a message from an ODW representative making sure that we let you all know that ODW does have a coronavirus info page on their website. And if we don't have it on our link, we'll make sure that we capture it and get it on our webpage to link you back to ODW. Economic impact. This is a big conversation. We heard from Chris and Amanda in the beginning a little bit about what's going on with that. AWWA estimates that roughly a $32.7 billion economic hit due to COVID-19. That's just in the water and wastewater industry. And that doesn't include power or anything else. There is some FEMA public assistance funding out there. There's a link on our page, and I believe there's a link on ODW's page also. And I would imagine DEQ's probably has this posted by now. And then, are you thinking about what your economic recovery plan is going to look like? We saw some questions in chat. What things are going on. We have a Q&A question that just popped up. The correction, my mistake, and I apologize. The AWWA report is just drinking water only, not water and wastewater. So that's a $32.7 billion impact just on drinking water. So thank you for correcting me on that, Adam. So are we working around our economic recovery plan? What does that look like for us? And like I said, Chris and Amanda kind of talked on that a little bit on the front end, but we need to be looking at what we're doing there. Our next slide.
Okay, under VA1, which we encourage everybody to join, it does not cost a membership. There's no annual dues. We realize with a lot of the smaller utilities, it's difficult for them to respond to an emergency, but it allows, by being a WARN member, it allows the larger utilities to respond to assist you. The WEA Act, which was signed into law October of 2018, it states in there in the manual for emergency planning that it is recommended and highly encouraged for everybody to join the WARN so they have a backup as their emergency response plan. If you would like to join WARN or get some more information on it, you can go to our vawarn.org and go to members and check and see what's there. They're all the paperwork and documents that need to be filled out are available online. We've had some people say in the past that their mutual aid agreement, the lawyers won't allow their mutual aid agreement to be in place, but they've already got fire departments and police departments in your jurisdictions, and they all have a mutual aid agreement, so that doesn't fly. That's all I have. Thank you.
Michael, that's a great question about the WEA deadlines remaining the same. As of right now, I've not heard anything from EPA on those deadlines being extended based around COVID. I think you've heard on some of our other webinars that basically EPA is still mandating that you meet all your requirements. But as far as the WEA Act itself, I've not heard anything on an extension, but we'll definitely dig into that one for you, because you're not the only utility that would have that question. That's an excellent one that we'll touch on.
Like also another clarification under the WEA Act,
Mm-hmm.
If you have 3,300 people, we're not talking about connections, but there's people in your community that you serve, you have to fill out the vulnerability assessment exercise, and you have to do the all hazard emergency response plan.
Correct.
So a lot of people are getting confused between meter services and counting that as a customer. If there's 10 people living in the house, those 10 people count. So it's people, not connections.
Roger that. That's a good point, Mike. Geneva, did you want to talk about continuing education, or do you want me to hit this?
Yes,
one?
please. I'd be happy to share that we are very excited that we can provide continuing education credits for these webinars. We do thank so much to DPOR for giving us the ability to modify procedures slightly in order to allow that to happen. Engineering CE credits are also being provided. So if you are a water operator, wastewater operator, or engineer, please complete the poll that should be on your screen, and or you can send an email to scott.smith@vaawwa.org, and we will do our very best to get you a transcript. Transcripts will be coming, kind of an all-encompassing list. So anything that you've attended or requested over the past several weeks, we're going to combine them up into a certificate and get them sent out at a future date. It may be 1 to 2 weeks. We may wait a little bit longer because some of you that are very faithful to these webinars and attend week after week, we want to send you one complete transcript with all of the sessions that you've attended. But if you can, we'll actually end the poll and just share it with everybody so you kind of get an idea of who all is on the call today. We've got 37% water operators, 21 wastewater, 37% engineers, and 20% are just here listening, much like myself. Thankfully, don't have a license requirement, but I'm happy to be here. So again, complete the poll, or at this point, send an email to Scott Smith, and we'll make sure you get some credits for today.
And Scott is Geneva's new person that'll be starting with her here.
Yep, already.
Yep, go ahead.
Nope, I was just going to say he's already with me, thankfully. He's going to be in Virginia shortly, and hopefully you'll all get to meet him at a future event. So from Robert, he posted this around the risk and resiliency assessments and EPA updates, that he talked with EPA and extensions on submittal deadlines are not possible because the deadlines are statutory, but unofficially, they will work with utilities if there are COVID-19 impacts. So we'll try and see if we can't find that guidance, and maybe we can get that guidance posted. Okay. Thank you for all your information. And then here's our contact information. If you guys have any follow-ons or you want some other information put in there, especially around the supply chain list, because some of you said it wasn't helping you. If there's things that you need on there that we're not already addressing, please share it with us, and we'll see what we can do to get that accomplished on there. All right. For our panelists, our guests that we had, I really want to thank you guys for the information you had. It was great. Chris, Amanda, Eddie, thank you so much for sticking with us to the end, and appreciate it. And any questions we get after this that may be addressed to you, we'll send them to you and see if we can't get you guys linked together. I very much appreciate it. Mike, Scott, Geneva, do you have anything for the group?
No, I don't have anything else to add. Thank everybody for being here.
Thank you. All right, I want to thank everybody. We went a few minutes over, but we look forward to seeing you next week. Go ahead, Geneva.
I was just going to say thank you so much for joining us, and definitely keep an eye on the website and come back next week. We're going to have some new guest speakers. We'll try our best to let everybody know who they will be for next Wednesday, and we hope we can have you back again. Have a great day, everybody.